Imagine for a second, you're sitting at your kitchen table. It's 2 in the morning.
The absolute worst time to make a major decision, by the way.
Right. It really is. But there you are, staring at a browser full of these glossy brochures for senior living. And, I mean, you have absolutely zero medical training.
Which is exactly the position most families find themselves in, unfortunately.
Yeah, and that's exactly how most families end up choosing a senior care facility. You suddenly realize your dad or your mom needs, more help than they're getting. Panic sets in, and you turn to the internet to try and fix it.
You're just looking for a lifeline in the middle of the night.
Exactly. And if you are listening to this right now and you've been in that position, or maybe you're in it today, you already know that navigating elder care is, quite simply, one of the most emotional, high-stakes decisions your family's ever going to make.
It really is. I always call it the definition of diagnostic muddy waters because, when someone breaks an arm, it's a clean binary medical issue. You look at the x-ray, right? It's broken or it isn't.
Right. It's very straightforward.
But in elder care, it's like the x-ray machine itself is broken. I mean, the sheer volume of choices, the complex terminology, that immense weight of the responsibility, it just leaves families feeling entirely paralyzed.
Paralyzed. Yeah, that's the perfect word for it.
And because it is such a sensitive, delicate transition, that paralysis can often lead to decisions being made out of sheer exhaustion, rather than any sort of informed clarity.
Which is precisely why we are doing this deep dive today. We really want to cut through that exhaustion and, the confusion for you.
Absolutely.
So we have an incredibly thoughtful, profoundly helpful set of insights today from the experts at Washington Senior Care Advisors. We are unpacking their comprehensive guide, and it's titled The Nurse Advantage: Navigating Senior Care Excellence in Washington.
It's a fantastic resource, really eye-opening.
It is. And our goal today is to sort of explore a complete paradigm shift in how families approach this entire process, moving away from those frantic midnight internet searches and moving toward true, clinical advocacy.
Which is so vital. And I think what we really need to examine first is the mechanism of how this search usually goes wrong.
Oh, for sure.
Like, why having a true healthcare professional, specifically, a registered nurse acting as your personal advisor, why that fundamentally changes the entire landscape. Because the way the industry is often set up right now, I mean, it almost preys on that 2 a.m. vulnerability you were just describing.
Yeah, let's definitely unpack that initial search. So you're at the computer, you type assisted living near me into a search engine, and you find what looks like a really helpful portal, right?
Right. They always look very official.
They do. So you type in your mom's zip code, maybe you put in your phone number, thinking, you're going to get a nice curated list of local places. But what actually happens behind the scenes with those massive national referral brokers?
Well, what actually happens is that your personal data is instantly commodified.
Wow.
Instantly. Instantly. Those national portals, they are essentially operating as data brokers and, logistics algorithms. The moment you hit submit on that form, your phone is going to start ringing off the hook.
I've heard horror stories about that.
Oh, it's a nightmare. You get bombarded with calls from sales directors at facilities you have never even heard of. And the kicker is they know absolutely nothing about your mother's actual medical condition.
They just know there's a lead in their zip code.
Exactly. The national broker simply blasted your contact information out to literally whichever facilities in that area have empty beds and, pay for their leads.
So they are essentially functioning as lead generators. They're completely disconnected from the human reality of the actual situation.
Completely disconnected, yes.
I was thinking about this, and I came up with an analogy that might make sense of this for you, the listener. Using one of those standard national placement services, it's kind of like using a real estate broker who just shows you open houses.
That's a really good way to put it.
Right. Like they tell you the square footage, they point out the nice granite countertops in the dining room, and they say, hey, a room is available on the 1st of the month.
Yep. Just the surface level stuff.
But working with a true local advisor, like a clinical advisor from Washington Senior Care Advisors, is like hiring a building inspector and an architect rolled into one. They actually know if the foundation of that care facility is sound enough to support your parents' very specific needs.
I love that analogy, but I would actually take that a step further, if you don't mind.
Oh, please do.
So a building inspector just tells you if the house is generally up to code today, right? But an RN advisor, they are telling you if that house will survive a very specific kind of earthquake that might hit, say, 2 years from now.
Oh, wow. I see what you mean. Looking into the future.
Exactly. They are looking at the medical progression of your parent's condition. A national broker who's just looking at a zip code, they cannot account for a complex trajectory of Parkinson's disease or, the behavioral nuances of Alzheimer's.
Because they're just trying to fill a vacancy.
Right, they're just filling a bed. But a true local Washington advisor, they are physically touring these facilities. They know the local staffing patterns, they know the management history, and they know the actual culture of care inside the building.
Okay, so if the RN is looking for that specific clinical capacity, the immediate question that comes to my mind is, what are they actually seeing that I wouldn't see?
That is the million-dollar question.
Because, I mean, if I tour a place with my dad, I'm going to notice the beautiful chandelier in the lobby.
Of
Right?
course, it's designed to be noticed.
Yeah, and I'm going to look at the menu to see if the food looks appetizing. But I imagine a clinical advisor is looking at entirely different indicators. Like, are they looking at the medical carts in the hallway? Or checking if the staff looks frantic versus, focused?
That is exactly the distinction, because a chandelier does not answer a call button at 3 in the morning.
Wow. That's entirely true.
When an RN advisor from Washington Senior Care Advisors walks into a community, they are bringing decades of experience in geriatrics, in chronic disease management. They are looking right past the marketing.
They see right through the granite countertops.
Exactly. And to your point about frantic versus focused staff, that is a massive clinical indicator. If caregivers are, sprinting down the halls, looking completely overwhelmed, that tells a nurse that the caregiver to resident ratio is dangerously stretched, regardless of what that polished brochure might claim.
Let's talk about that mechanism of care for a second. What does a poor staffing level actually look like in practice versus a facility that an RN would, actually approve of?
Let's look at a practical example.
Because on paper, I'm sure every facility says, we have staff on site 24/7.
Okay, I'll say that.
Yeah.
But let's use a very common scenario.
Yep.
A nighttime fall. In a facility where the staffing is stretched too thin, or maybe they just lack proper clinical oversight, a resident might try to get out of bed to use the restroom at 2 a.m. So they push their call button. But because there is only one aide covering, say, 2 entire floors, that button goes unanswered for 15 minutes.
Oh, no.
The resident gets tired of waiting, they attempt it alone, they fall, and they fracture a hip.
Which is absolutely devastating.
It is. But in an RN-vetted facility, the nurse advisor has already verified not just the raw number of staff, but their specific nighttime protocols. They check the proximity of the aides to the high-fall risk residents. They look for the presence of proactive rounding.
Proactive rounding. What does that mean exactly?
It means the staff is actively checking in on residents before the call button is ever even pushed.
Okay, that makes a huge difference. But let me push back for just a second.
Sure.
If I am a family member listening to this, I might think, wait, isn't it the care facility's job to know all the medical stuff? Like, why do I need to bring my own nurse just to pick the place? Can't I just trust the facility's own nursing director?
It's a very natural assumption to make, but it totally ignores the fundamental dynamic of the whole process.
How so?
Well, the facility's nursing director works for the facility. Their job is to manage their building and, frankly, to market their best selves to you. But an RN advisor works for you.
Ah, I see. It's about who they advocate for.
Exactly. They're looking at the facility through a deeply clinical, highly critical lens purely on your behalf. They take your parents' complex medical charts, they translate those confusing physician notes, and they basically cross-examine the facility.
So instead of me just asking, do they get 3 meals a day, the RN advisor is in there asking the hard, specialized questions.
The questions you wouldn't even know to ask.
Right, like they're asking, what is your exact protocol when a resident's mobility declines rapidly? Or, say, in the case of dementia, how exactly is your staff trained to de-escalate sundowning?
Yes. Exactly. And let's look at sundowning for a moment. That severe confusion and agitation that dementia patients often experience late in the afternoon as the sun goes down.
It's really tough for families to manage.
It's incredibly difficult. And de-escalating that requires highly specific, clinical training. It's not just a friendly caregiver offering a cup of tea.
Right.
It requires understanding environmental triggers, modifying the lighting, utilizing specific behavioral redirection techniques. A facility's marketing director will just tell you, oh, we handled dementia beautifully.
Of course they will.
Right. But an RN advisor will sit down and ask to actually see the specific charting mechanisms they use to track those behavioral triggers. They will verify the staff's actual training credentials in cognitive de-escalation.
That is a massive difference. So if the RN is meticulously measuring this clinical capacity, what are the actual state standards they are measuring against? Because in Washington, that brings us straight to the regulatory environment, which I understand is highly specific.
It is very specific. The Washington State Department of Social and Health Services, or DSHS, they oversee the licensing and regulations for all senior living in the state.
Okay, DSHS.
And this is where having local expertise is just non-negotiable. If your advisor doesn't deeply understand Washington DSHS standards, they cannot adequately assess a facility's compliance.
Right, because how do they know what to look for?
Exactly. Without that knowledge, they might recommend a place that looks beautiful on a tour, but actually has a history of severe DSHS citations for, say, medication errors.
That's terrifying. So the guide from Washington Senior Care Advisors explores this by detailing the specific care options. And rather than just listing them out like a textbook, let's think about this from the perspective of a family whose needs are, actively evolving.
Okay, let's do that.
Let's say a family starts out looking at standard assisted living. What does that actually entail under Washington rules?
So assisted living is often the starting point for a lot of families. It offers private housing with a big focus on independence, but it also provides meals, help with medications, and support for daily activities, things like dressing or bathing.
Okay, so a nice balance of independence and support.
Right. And under DSHS standards across Washington, so we're talking from Snohomish down to Pierce County, these facilities have rigorous safety protocols. If a resident just needs a bit of physical assistance and some medication management, an RN advisor can easily identify the assisted living communities that truly excel in those specific areas.
But what happens if that resident's cognitive health begins to decline? What happens when mild forgetfulness transitions into active wandering or a formal Alzheimer's diagnosis? That's when those DSHS regulations for memory care become absolutely critical, right?
Precisely. And this is where we really have to understand the why behind the care. Dementia strips away short-term memory, which makes unpredictable environments absolutely terrifying for the person experiencing it.
I can only imagine.
In a standard assisted living setting, the bustling activity, people coming and going, alarms sounding, that can cause severe sensory overload and massive anxiety for someone with dementia. Memory care, under DSHS mandates, is entirely different.
Right. The guide specifically mentions consistent routines in memory care. Why is that routine so heavily regulated and, well, clinically vital?
Because a consistent routine acts like a cognitive prosthetic.
Oh, a cognitive prosthetic. I like that.
Yeah, when the environment, the schedule, and the faces are entirely predictable every single day, the resident's brain doesn't have to panic trying to process new, frightening information.
It takes the pressure off them.
Exactly. DSHS regulations mandate specialized training for staff to provide this structured environment, alongside secure perimeters to physically prevent wandering. You cannot just slap a memory care sign on a hallway door and call it a day.
Though I'm sure some places try.
They do, but an RN advisor knows how to check if a facility is merely locking the doors to keep people inside versus actively providing therapeutic, cognitively supportive programming.
That distinction alone could save a family just so much heartache.
Absolutely.
Now, this brings us to a third care model in Washington that I think will be a completely new concept to a lot of our listeners: adult family homes.
Yes, these are fantastic.
The guide describes them as smaller residential settings, usually serving 6 or fewer residents, and they're tucked right into regular neighborhoods. And I have to admit, my initial reaction to this is a little bit skeptical.
Oh, really? How come?
Well, how does a small 6-person house sitting in a regular residential area of, Spokane or King County actually provide the same or even better medical oversight than a massive assisted living building with a huge staff?
It is a brilliant question. And it really comes down to the intimacy of the care. Think of it this way. In a massive facility, a caregiver might be responsible for 15 or 20 residents across a really wide wing.
Right, they're spread thin.
Very thin. And so if your father develops a urinary tract infection, which, by the way, in older adults can cause sudden, severe cognitive confusion and physical weakness.
Wait, really? A UTI causes confusion?
Yes, it can literally mimic dementia symptoms almost overnight in the elderly.
Wow, I had no idea.
It's very common. But in a big facility, he might just seem, a bit tired to a passing aide who only sees him for maybe 10 minutes a day.
Right, he just blends into the crowd.
Exactly. But in an adult family home, that caregiver to resident ratio is incredibly high. That caregiver is making breakfast for the exact same 6 people every single morning.
They really know them.
They know your father's baseline perfectly. They will immediately notice if his balance is suddenly off by 2 inches or if his speech is even slightly delayed that morning. That intimacy allows them to catch infections or subtle medical shifts days before they become full-blown hospital emergencies.
Wow, okay, that makes complete sense now. The small size isn't a limitation, it's actually a clinical feature. It acts as an early warning system.
Correct. It's a huge advantage. And to address your concern about the medical oversight, these are not casual, under-the-table living arrangements. DSHS licenses adult family homes with extreme rigor.
Okay, good to know.
They enforce strict standards for individualized care plans and living conditions, but because there are thousands of these homes across Washington, the variance in quality can be pretty wide.
I would imagine so.
Some might specialize in complex diabetes management, while others might excel in late-stage dementia care. And this is exactly where the Washington Senior Care Advisors team steps in. They evaluate the specific staff qualifications in that specific home, they review their DSHS compliance history, and they match it directly to your loved one's specific clinical needs.
So we've walked through the pitfalls of those national brokers. We've talked about the immense value of an RN's clinical advantage and the actual DSHS-regulated care models in Washington.
We've covered a lot of ground.
We have. But practically speaking, if you are listening to this and you realize, okay, I absolutely need this level of clinical guidance, how does the actual advisor journey work? Like, how do you ensure the person you are talking to is a true advocate and not just another referral machine?
It all starts with a comprehensive clinical consultation. A true advisor does not just ask for your zip code and hit send.
Right, no algorithms.
No algorithms. They sit down and they actually listen to your loved one's health history, their daily routines, your family's geographic needs, and yes, your budget. They are gathering the data required to build a real clinical profile.
And from there, they don't just email you a list of options, right? This is where the physical advocacy comes in.
Exactly. Finding the community on paper is only step 1. The best advisors, like the RNs at Washington Senior Care Advisors, they take that overwhelming mountain of options, they narrow it down to the 2 or 3 that actually fit, and then they physically accompany you on the tours.
That is so huge, having them right there with you.
It changes everything. They are right there next to you, asking the nursing directors those hard, complex medical questions we discussed earlier. They are basically your shield against all the marketing spin.
And their job isn't even done when you sign a lease, right? They coordinate the follow-up, answer questions during the move, and really help smooth out that highly sensitive adjustment period after your parent actually moves in.
Which is often the hardest part for the family.
Definitely. Which brings up an incredibly important point, and frankly, one of the most surprising things I read in the source material. We really need to talk about the financial model here.
Oh, absolutely. This is key.
Because, you hear registered nurse, personalized clinical advocacy, accompanied tours, and you naturally assume this is going to cost a massive hourly consulting fee. But according to the guide, this service from Washington Senior Care Advisors is 100% free to the families.
It is.
How does that business model actually work without compromising the family's best interests?
It is such a critical question about transparency. In Washington state, the way ethical senior placement agencies operate is by being compensated by the care communities themselves.
Sort of like a recruiter.
Exactly like a recruiter. A recruiter is paid by the company, not the job seeker. However, the crucial differentiator with an ethical local agency is that they prioritize the family first, above everything else. They maintain absolute transparency about how they are compensated, and they strictly follow Washington state referral requirements.
So by removing that direct fee to the family, it completely removes the financial barrier to getting help.
Precisely.
Families who are already under immense stress They don't have to weigh the cost of getting professional clinical advocacy against the cost of paying for the care facility itself.
Hmm.
They don't have to choose between, keeping their budget intact and making a safe medical decision.
Exactly. It ensures that clarity and compassion are the true driving forces. The family can focus entirely on what actually matters, the safety, the comfort, and the quality of life of their loved one.
Knowing they have a professional in their corner.
Right, knowing they have a clinical expert navigating the complexities of the DSHS system for them. They aren't paying out of pocket for the privilege of not making a terrible mistake.
So, what does this all mean for you listening today? Let's bring this all together. Choosing senior care is not just a real estate transaction.
Not at all.
You are not just finding a nice apartment that happens to have grab bars in the bathroom. It is
Yes.
fundamentally a clinical decision, and it is a profoundly personal one. Trying to navigate it alone at midnight through a national data broker, it's just a recipe for immense anxiety and potential medical oversight.
It truly is. Having a local Washington nurse guide you through this process ensures that the clinical compliance is actually verified, the safety protocols are real, and the environment truly matches your loved one's specific needs. It just provides profound peace of mind during one of life's most challenging transitions.
If you're beginning this journey with your family, or even if you were just anticipating it in the near future, you do not have to do it alone. And you absolutely shouldn't do it blindly. We want you to take the next practical step right now.
The sooner you start planning, the better.
Exactly. Go to the Washington Senior Care Advisors website. You can access the full written guide we discussed today, explore their comprehensive local resource links, and most importantly, you can schedule your personalized consultation with a senior care nurse advisor. Let them bring that clinical lens to your family's unique situation.
They are equipped to walk with you every single step of the way, serving the greater Seattle area, King County, Snohomish, Pierce, and beyond. They are your local clinical advocates.
As we wrap up this deep dive, we want to leave you with one final thought to ponder as you navigate this process. When you are standing in a care community, looking at the beautiful dining room, smelling the fresh coffee, and holding a polished brochure, ask yourself this: are we choosing a place equipped only for who our loved one is today, or are we choosing a community with the clinical capacity to care for who they will be 2 or 3 years from now?
Because anticipating that future is the true measure of exceptional care.
Well said. Thanks for joining us on this deep dive. Take care of yourselves and take care of your families.